All right. Hello, all, and welcome to the EduTalk Diabetes series hosted by EZ, Biotone, and diabetes health and wellness experts. With the growing, because of the daily challenges of diabetes and interest in health and wellness strategies, we have partnered with Jennifer Pressimone, who will discuss the growing connection between dementia, type 3 diabetes, and the emotional struggles that lead to cognitive decline. Jennifer will explain holistic scents and aromatherapeutic strategies to support brain health, emotional balance, and share how to inspire clients and caregivers with holistic approaches. Jennifer, we're very happy to have you again, and I'm going to pass the screen on over to you so that you can introduce yourself and go straight into our talk today.
Thank you so much, Ceci. I'm so happy and blessed to be here with all of you. This is a very important topic. It's a very niche topic that's near and dear to my heart. And so we're going to be diving into holistic aromatherapy strategies and specific practices to strengthen brain. Specifically for dementia, we have a lot of research showing, and it's been labeled as type 3 diabetes. And that's why we've included it in this particular series. So I want to thank Biotone. I want to thank EZ for having me and allowing me to share this important information to help you on your emotional wellness journey as you navigate dementia and diabetes. So my name is Jennifer Pressimone. I'm a clinical aromatherapist and a holistic intuitive healer. I have been doing aromatherapy and practicing aromatherapy for about 23 years through my company, JennScents. I'm a product formulator and educator as well. And I got into aromatherapy for my own personal health reasons. I had a lot of intestinal issues, Crohn's, colitis, IBS. And when you have digestive and intestinal issues, there's usually some layer or some connection with a blood sugar imbalance. And when we have a blood sugar imbalance, it definitely affects our mood, our mindset, our emotions. And on top of my professional accolades from a personal level, I do have a personal connection with dementia. I recently lost my mother to dementia, but I was so blessed to be able to be on the journey with her over the years to help navigate her through the cognitive decline, the emotional distress that she went through, but also for me and my family as caregivers. And I think it's going to be really important. And I hope that you gain some valuable tips and information from this presentation that's going to help you on your journey, whether you're helping family, friends, clients, coworkers through this journey. So my objectives, what I want to share with you is to talk a little bit about what holistic aromatherapy is. How does it affect us and how can we use it for diabetes and for dementia, our brain health and emotional wellness, recognizing the emotional signs for both the person with dementia, but also for the caregivers and the people around, holistic approaches to support the type 3 diabetes, some aromatherapy and essential oil specifics. We're going to talk about customizing personalized blends to get you exactly what you need when you need it, along with some mindset, brain, and lifestyle tips, practical applications, and safety and hypersensitivity. So my personal journey, this is my mom, this is my mama. I have lost not only her, but other family members and friends and clients to dementia. So it is an honor to be able to walk through this stage of life with them. When you can do it a little bit more educated with a little bit more support tools, then it's helpful. It's when you get stuck in a situation of a crisis mode and don't know what to do and don't have the tools. And that's what I want this to be for you, is that toolbox of, okay, this is going on. What can I do in this situation? What oils can I grab? How can I calm certain emotions and behaviors that are going on? And how can I support myself as a caregiver? So type 3 diabetes, also known as dementia, it's diabetes of the brain. This is a progressive neurocognitive deficit and impairments that happen, and it's linked to these amyloid plaque buildup, this buildup in our brain that's impairing insulin. It's causing this scarcity of the cholinergic neurotransmitters, which basically is telling us that we have decrease in function and increase in agitation. So when you're seeing, these neurotransmitters not functioning properly, we know cognition is going down and that irritation is going up, inflammation is going up. It's going to affect rationalization, learning, thinking, mood, memory, emotions, behavior, social abilities. And so the more it progresses, these are going to get worse. And as they get worse, I'm going to teach you some things you need to know as a preventative, but also as a reactive that's going to help you through this. And then it's going to help you through this complex neurological condition that damages the nerve cells. It diminishes the physical, cognitive, and emotional capacities. It's manifesting with insulin resistance within the brain. And so something that I have seen not only with my mom, but with other people I was caring for, or that I was helping clients care for, is that as the dementia or cognitive decline increased, so did their craving for sugar. And so this is going to be something really important, because we know sugar is going to throw off blood sugar, right? And enhance and really affect our diabetes levels, whether it's pre or we're in the midst of it. And so there's a huge connection here. So adding in protein and adding in some lifestyle changes, but also adding in aromatherapy to calm those sugar cravings is going to be something that can help you when the behaviors start manifesting. So some statistics for you. Diabetes, type 3 diabetes, which is dementia, is the 6th leading cause of death worldwide. It's huge. And so we see brain changes that are detected 20 years prior. So at the onset, when blood sugar starts changing or shifting, or our numbers are looking different in our blood work, we really need to pay attention to that, because we start seeing some cognitive decline and cognitive changes. And it's been tracked back 20 years, right? So it's 20 years in the making before it's really prevalent. And then we start really getting this diagnosis or being labeled with cognitive decline or with this type 3 diabetes. And another thing that we notice is odor identification. There's a deficit. So as cognitive decline increases, olfaction ability decreases. So your ability to smell and decipher and distinguish between scents will be different. So this is what we call a biochemical response. However, this is so important. Even if you cannot smell, even if the person cannot smell, they have anosmia, which is no sense of smell, or hyposmia, the decreased sense of smell. Even if that happens, when you smell an essential oil, you breathe it in, it will still work, because those scent molecules travel in through your nose to your brain, connecting with your limbic system, right? So your hypothalamus, which is helping it travel throughout, your whole body through the vagus nervous system. It's connecting with the amygdala, which is your fear center, and fear we know gets worse with dementia, and your hippocampus, which is responsible for memory storage. So even if you cannot smell, when you breathe in a scent, it still will work. I just want you to really understand that, because it's so important. A lot of people think I can't smell, so I can't do aromatherapy. It's even more important, because that's a type of cognitive exercise. Olfaction is a type of cognitive exercise. And so recognizing signs Now, there's a lot of overlap in the emotion that someone is going to experience, whether you're the patient going through dementia from beginning to end, but also for the caretaker. And so there's a lot of burnout, anger, grief, fear. That's going to happen for everyone that's involved. But for the patient's emotions, there's this internal turmoil going on because they're living with it. And then as the caretaker, it's really tough because we're watching it from the outside. So it's this external turmoil that we're feeling, right? And so anxiety, as the patient, you're going to see with dementia that there is elevated anxiety directly connected with the blood sugar imbalance. As blood sugar goes awry and gets more imbalanced, anxiety will be higher. Space, time, reality will be distorted. They're not going to have space. They're going to try to point to something and they're trying to point here, but their finger's going to be over here. Time, they're going to think, oh, one thing with my mom, she thought she was in a place for 15 minutes or for 2 hours. She thought, when we went to visit my sister, she was there for 2 hours, but it had only been 15 minutes. So time, when you can bring in aromatherapy to help anchor some of these moments or these experiences, it can help you navigate these emotions. Fear and loneliness, suspicion and anger will be high. As the caregiver, we're going to see worry. Our stomach is going to be in knots all the time because we're just worrying so much. There's fear, there's shock, there's disbelief. Is this really happening? And that's a really hard one because there's times for me and my mom, there were times when we had the best conversation. She was so with it and so cognitively aware. And then she wouldn't be. And so we kind of struggle with this, they're here and then they're not. And so it's a disbelief. Is this really happening? Stress, sadness, depression, grief, burnout, anger. And so emotions are the same. They're just happening from a different perspective and different timing. So on a physical level and biochemical changes that's going to happen. Now there's 3 specific things, your hormones, neurotransmitters, and metabolism, that are strongly affected by type 3 diabetes, but also can be balanced and regulated to some extent using holistic aromatherapy practices. So hormones affect our mood, neurotransmitters affect our thought, metabolism affects the speed of which we process information. So some things you're going to notice when hormones are going awry, you're also going to notice a correlation, direct correlation with blood sugar being off is moodiness, emotional discordance, irrational behavior, not thinking clearly. With the neurotransmitters and the thoughts, the sluggish thinking, the memory loss, inability to learn and grasp ideas. It's not just the tip of the tongue syndrome. They really cannot formulate whole pictures. And then with the metabolism, there might be some more swelling and lymphatic congestion, poor circulation, nervous system atrophy like dysautonomia. And so the major contributor to sundowners, specifically between 12 p.m. and 3 p.m., these are going to change. You're going to see shifts here with the physical and biochemistry, usually between 12 and 3. Sometimes it's closer to 3, but the more it advances, it's going to creep up more around lunchtime. This is the time you want to start diffusing your essential oils. If we can catch it a little ahead of the curve, the better the outcome or the quicker the outcome. So your 4 holistic approaches and solutions. The goal here is to use these solutions to help you manage responses and reactions to the associated emotions, the mindset, the memory decline for both you as the caregiver and you as the patient. And so aromatherapy, mindset, breathing and circulation, movement, and lifestyle. So with aromatherapy, we're going to be using essential oils, the scent of the essential oils and energetic therapies. For the mindset, we're using it as an olfactory exercise, but also a cognitive exercise to strengthen the mindset, the brain, and cognitive support, to enhance our breathing ability and circulation, to calm the nerves, anxiety, and to help with that heart rhythm. And then for lifestyle, to support sleep, having some fun, having some laughter, journaling, movement, and food support. So let's start with aromatherapy. So what is aromatherapy? Many of you already know we're using essential oils. Aromatherapy is a practice that utilizes essential oils to shift our mood, mindset, our energy, to help us behave in a certain way, to calm reactions and strengthen our proactive responses. And it's working because when you smell a scent, when you breathe a scent in, and if you have an essential oil, I want you to breathe it in and smell that scent. It's activating your limbic system. That happens. Your sense of smell is the only sense you have that bypasses your analytical side, your logic side of your brain, which means there's no judgment. It acts quicker than you can snap your fingers. Science just recently showed us it's less than a third of a blink, that it activates physiological and psychological movement within the body. And so it can calm agitation and anxiety and fear and nerves with one sniff. So activating that part of your brain. And then therapeutically, we're having more focus and concentration. We're going to balance emotions better, calm and soothe any of those emotions that come up. And physically, it can calm that irritation, pain, inflammation in the body with organs. And then energetically, it can provide this level of protection against some maybe negative thoughts going on, and connect more on a spiritual level. And to personalize this, we're going to use various essential oils and pair them together to create a very personalized blend. Where are they now? What do they need right now? And let's get some very precise results. You're also able to adjust them. And research studies show, even back through ancient practices, that the best way to use oils is to smell them. So we're going to talk about 8 specific essential oils. And so these are the ones that I have on hand, that I had on hand to work and to help with my mom through her dementia, that I work with clients going through that. So cedarwood or Cedrus atlantica, eucalyptus globulus. You can also use eucalyptus radiata or smithii, frankincense, so Boswellia carteri or sacra, lavender, so your lavandula angustifolia, your citrus limonum, which is lemon, citrus sinensis, which is sweet orange, peppermint is Mentha piperita, and rosemary, which is your Salvia rosmarinus, which was formerly known as Rosemary officinalis. So before we get there and talk about those in more detail, let's talk about some mindset support and shifts that can help you. So as you go through this journey, trying to support a positive mindset as much as you can. It doesn't mean you have to just constantly live in the bright side and ignore real emotions that come up, but you can't stay there. We need to move forward. Emotions are like a clock. We should experience them and move forward. And so to stay in this state of awareness and to foster our beliefs and stay in the state of compassionate care, then we need to work on having a positive mindset, because you're going to pick up on energy shifts, and so is the person going through dementia. Through your scent journey, when you smell a scent, you're breathing in through your olfactory bulb. This is going to identify the scent. Your amygdala is your fear center, but it's also your courage center. So when fear gets heightened, and their fear will get so bad, and usually there's this fear of falling. They might struggle with their walker, or they struggle to take a step up or a step down, because there's such strong fear. That's because the hippocampus and the amygdala they're right beside each other. And as the hippocampus starts disappearing, that amygdala just keeps getting triggered over and over and over. And so fear gets heightened. And so we want to use certain oils to calm that down. And then that's why memories start going, and we have a lot of more recent memories disappearing. And that's why they'll remember something that happened a really long time ago, because that's in a different storage area. And then your hypothalamus, this is what it's allowing us to breathe in the scent and really connect with the emotions and the memories that it provokes quickly without judgment. And then your essential oil pairing here, you're going to be able to identify specific essential oils that are supporting cognitive function and mood at the same time. We're going to get some versatile benefits here. And really important to use what they like. We want them to like the scent through this journey. Now, we have some research that came out that showed lavender in an aromatherapy hand massage was very effective on emotions and aggressive behavior in elderly patients with dementia and Alzheimer's. And so maybe adding in some lavender or another essential oil into some cream or carrier oil and using that as a hand massage can be very helpful in calming the mindset, but also calming the emotions and the blood sugar balance. So more aromatherapy research, just to give you some efficacy here. There's some studies that's linked diabetes as a risk factor for Alzheimer's and other type of dementia. And so the incidence of patients with type 2 diabetes and increased level of activity of the alpha amylase is higher in patients with dementia. And so we've seen aromatherapy with essential oils in the mint family really help. And so we have mint, of course, lemon balm has been very specifically shown to help with performance, cognitive performance in those with different types of dementia. And then we have aromatherapy shown a safe and viable non-pharmacological treatment to improve the behavioral and psychological symptoms with people with dementia, and doing that in a massage form. So massaging the feet, massaging the hands, massaging the scalp, massaging the back. And then we also see that some studies shown that aromatherapy effectiveness when they diffused essential oils at nighttime increased cognitive performance the next day by 226%. Now, there were certain oils that were used and diffused singly each night. So this was a very profound study to show even diffusing the scents at nighttime can help improve cognitive function. So your mindset essential oils for the patient and the caregiver. So you want to smell these oils because it's exercising the cognition, it's stimulating neurotransmission, enhancing memory recall and learning ability. So I like to pair lavender with frankincense and lemon and rosemary. I like these four together. You certainly can pick one or two or three or all four. You can add them into a bowl of Epsom salt for a non-electric diffuser option, or add that to the diffuser. You can pair it with brain games and use it as an anchor scent. You're anchoring whatever they're learning is going to make it easier to recall. So we have psychological studies that show whatever you're doing at the time you're taking in that information, you want to do at the time you're retrieving that information, because we have memory association and memory recall. So when you add it with scent, it's so much more powerful. So you can add that in a morning routine, pre-sundowners. Now, for the caregiver, we want to use it for focus, concentration, and to manage our responsibilities, navigating conversations, staying alert. So for this instance, I like the combination of orange, lavender, peppermint, and cedarwood. And that with journaling, meditation, and an aromatic bath. You can put it in a diffuser, necklace diffuser, a nasal inhaler, a room spray. You can also put that in a spray or add a couple drops to a scarf or bandana. You can also create this blend and add it to a face oil or cream. So some mindset tips. Scent can train the brain, and that's why I'm asking you to pair it with an activity. It's going to help us be more proactive. The sooner you can start implementing scent therapy with someone with cognitive decline, hopefully we catch it before we even notice it. The sooner you can do it, the better the results you're going to get and the quicker the response. So I have used aromatherapy with my mom for 23 years. That's how long I've been doing this. She loves her aromatherapy. And so in her final stages of dementia, when her mind was completely gone, I could say, "Hey, mom, smell this oil." And she would go right and try to sniff it. She would go right into sniff mode. She understood what I was asking her to do. She would sniff the oil. "Yeah, I like that one." "Okay, well, how does it make you feel?" She would tell me. I would ask her, "What thoughts come up? Does it remind you of anything?" And then I would engage her thinking. And she came back to me every time I did that. Even when she was completely gone, I got to see firsthand the power of aromatherapy working with my mom. And I've seen it happen time and time again with other clients and with other family members. So the more you can implement that right now, the better. Now, we can still be in reactive mode, even if you've not done it and you're introducing it for the first time. Be consistent, avoid oils that agitate, and repeat several times throughout the day. It would be better if you can pair it with an established habit. If they're going to eat, sniffing an oil and sniff that same oil. So now you're teaching their mind and their body, "Oh, I'm smelling lemon. That means I'm going to eat." We're putting in a routine that's going to allow us to retrieve and connect. What we're trying to do is connect on a level, right? Even subconsciously, if their mind is completely gone, we can still go in and reach them on some level by doing this. With breathing and circulation. So breathing exercises is going to help with stress, anxiety, depression, sundowners, anger, agitation, using olfactory sensory testing in aromatherapy sessions. So having them smell oils throughout the daytime. And let's see what they like. This is a great way to balance emotions and to manage their blood pressure throughout the daytime. And then for circulation, it's going to help them and help you anytime there's maybe some stagnation, you're staying in one emotion and it's just fixated. And we need to enhance oxygenation. So some key tips is with a proactive routine, start it now. With a reactive mode, pair it with an activity that's already established. And so some oils that I like to enhance breathing, eucalyptus or ravensara, peppermint, or thyme and lemon. With lifestyle, we want to support sleep because their sleep is not going to be good, which means your sleep's not going to be good. So it's so important. Your brain recovers and replenishes through the nighttime when we're sleeping. It also replenishes the adrenals. So a formula that I like is the lavender, frankincense, sweet orange, and cedarwood to help get a good night's sleep. Try to journal about 5 to 15 minutes a day. I like the pairing of lavender for nurturing, cedarwood for grounding, sweet orange for adrenal support. You can pair this with some coloring books or brain activities, something that's fun. And so this really was really good to help document, reality, validate feelings, and get them out of this fixation state, right? It's going to help you and help them through and gain some more sanity moments to stay in the moment more. So you want to journal, but also ask them, whether they're coloring or doing some brain activity. And then you have to add in some level of fun. We have science that shows your immune system is cut in half. It's suppressed by over 50% when we're sad, but it can magnify more than 200% when we're happy. So we need some fun in this. maybe put on a show that they might remember where they laugh a lot, or put on a video of just a baby laughing. Get them laughing, get you laughing. Also creating movement that's going to keep circulation moving. So I like the combination of peppermint, lemon, cedarwood, and rosemary. And then, of course, managing food and herbal supplementation, hydration levels, minerals, passion flower, and melatonin were really important, especially for sleep, but to handle anxiety. Lion's mane has been shown very powerful for brain health. Also, some proteins and vegetables. And then adding in some digestive supporting scents with frankincense, lavender, peppermint, and lemon. I also like Roman chamomile here for digestion. Now there's 4 blends. Now I realize as you're helping somebody go through dementia, it's going to be very challenging and it's really hard to figure things out. So for me, I found 4 particular blends that work time and time again. So I had these 4 blends on hand at all times. Now, one blend I used in the morning and at dinner. So this was really helpful for me. So in the morning time between 6 and 10, we would smell this particular blend when she woke up. This is for my mom. So when she woke up and when I needed her to focus, I also used it at dinner between 5 and 8 to help with digestion, reduce agitation. And so we did 2 drops of frankincense, 3 drops of lemon, 3 drops of rosemary, 2 drops of lavender, and 2 drops of peppermint. Now I added these to a nasal inhaler. And so you have different scent sticks that you can use. And then you will add right in here and you will smell it. And so that was for morning and dinner. Now for the early afternoon between 10 and 12, 10 a.m. and 12 p.m., this helped with the SAD management, stress, anxiety, depression, pre-sundowners. So we did 4 drops of eucalyptus, 4 drops of peppermint, and 4 drops of lemon. And then in the mid-afternoon, to reduce the sundowners, to get ahead of it, we did 3 drops of peppermint, 3 drops lemon, 2 drops cedarwood, and 2 drops rosemary. Now you can make these up in a stock bottle. You can add them to a diffuser like the nasal inhalers because it was very easy. Just make sure you label them. And then at bedtime between 8 and 10, we want to associate this with sleep. So we did lavender, 4 drops lavender, 2 drops frankincense, 2 drops sweet orange, and 2 drops cedarwood. You can also put these in a roll-on because that will make it really nice. And if you're going to do a foot massage or a hand massage, that can be very helpful as well. And just a side note, if you're going to make up a 5 ml stock bottle, you want to multiply these recipes I'm giving you by 10 to get enough drops to fill up a 5 ml bottle. So your application methods, inhalation. Of course, we know inhalation is the fastest route. It's the quickest route. It's the most effective way to use oils through an ultrasonic diffuser, a reed diffuser, necklace diffuser, using it in a room spray, a linen spray, or as a deodorant, as a body or face lotion or massage oil. I like calendula and arnica creams because usually as we age, maybe there's thinning of the skin and helping with the bruising, you can kind of get a 2-for-1, helping the skin and the mood at the same time, doing like a golden salve or a roll-on, or doing smelling salts, adding Epsom salt or sea salt to a jar. This is a non-electric way if you want to keep electronics away. Just make sure they don't eat it or they're not, and it's not in an area where a pet or the patient with cognitive decline is going to grab it and eat it. Now, some safety guidelines I want to walk through is just paying attention to hypersensitivity. There are several safety guidelines. We want to be careful with blood thinning oils like cinnamon and wintergreen for somebody on coumarin or taking blood thinners. We want to be very careful not to exasperate that. There's certain essential oils like St. John's wort you wouldn't do if they're taking antidepressant medications. We want to be careful on how much we use because it can trigger or activate asthma or epilepsy if you're using too drying of oils. That's going to trigger things. And we're talking a high amount diffusing it. But if there's other allergies, nut allergies, we want to be careful of. We want to keep essential oils out of the reach of those with cognitive decline so they don't drink or eat it. And then storing them in an area and making sure that you're diluting it in a carrier before you use it. So important. But one of the biggest things that most people forget is to assess the hypersensitivity. How much can they handle? Just because I give you these recipes, it still might be too strong for them. So you might have to cut that down. You might have to use less because one drop might create this big response. Even if they cannot smell, it's still going to work. And so we want to be mindful. More is not better here. We need to keep very low dilutions and just have subtle shifts. Because if you create a big shift, it can throw them into an irritation or agitated state very quickly. So to conclude our talk on this, I just want to reiterate scent is so powerful at improving mood and cognition. It's nice to have your essential oils on hand ahead of time to make up the blends that you need ahead of time to make sure they're stored properly and that you have ones that are going to support both you and if you're the caretaker and the patient throughout this journey. Be consistent, be intentional, follow those safety guidelines, make it a part of your daily routine. So you sniff an oil, they sniff an oil. It's something you can do together, right? It's this nice connection that you have with them. And it's going to help your mood at the same time that it's helping them. And then you always want to meet the person where they are, not where you are. If they have advanced with dementia and their mind is completely gone and they think they're in a different location than they are, they're going to think they're in a different place with different surroundings and something is happening that's really not happening in reality, but in their mind it's happening. Meet them where they are. Bring them back. Oh, you want to go for a walk? Okay, well, let's go back inside and let's go pack or let's go get some things together before we do that. And have them smell a scent to lower that agitation. And then practice some lifestyle rituals. Work through helping better sleep, adding in some fun, adding in movement, journaling, working through the food and the herbal supplementation, working with a registered dietitian to help on the food side can be really important. So I want to thank you so much for having me. If you need support, products, or services, feel free to contact me at any time. If you want to learn more about using holistic aromatherapy practices for yourself or in your business, I have certification classes, I have continuing education classes, and I also have a free class on teaching you a little bit more on essential oils specifically for mental clarity and emotional balance. So thank you so much for having me. And Ceci, I'm going to turn it over to you.
Okay, here we go. Thank you so much, Jennifer. That was a really insightful talk on a topic that affects so many people. And tomorrow, we will send out an email with the recording link, the PowerPoint copy, and Jennifer's contact information. So please make sure to check your inbox or your spam if you don't receive it by the end of the day. But I do see that we have a question, Jennifer. Can you see it?
Yeah, I see somebody was commenting, there's some research studies showing dementia, diabetes, cardiovascular diseases are related to all long-term inflammation. Can we use highly anti-inflammatory oils to slow down the progression? How long does this effect last? after offering dementia clients aromatherapy blends. So yes, the oils that I shared with you have scientifically been shown to have anti-inflammatory properties. And we know any type of distress our body is going through, even with diabetes and dementia, there's a higher level of inflammation going on in the body. And so adding in highly anti-inflammatory essential oils will be beneficial, especially when you pair that with anti-inflammatory carrier oils. So some anti-inflammatory essential oils, frankincense has been shown, myrrh, lavender, cedarwood, all of these are greatly anti-inflammatory. And then carrier oils, arnica, calendula, nigella sativa, all have a lot of science showing their anti-inflammatory properties. Also, hazelnut is an oil. Now we have to be careful with hazelnut and those with nut allergies, but I did see a study on that and that I wanted to share with you. Now we still have to be careful on the dilution ratio that you're going to use. We want to use highly anti-inflammatory oils, but we just don't want to use it in a very high dilution. We want to be gentle until you know how the person is going to reply. Now, I've used aromatherapy with my mom for 23 years, all the way through her passing. And so she was well versed in that. So I was able to use a higher dilution ratio for her, but not too high. And I found I didn't need to. So I still got those responses. And then how long does the effects last? So anytime you smell an oil, right? Smelling an oil is going to go in and activate a response in the body, and that's going to elicit a response and maintain that response for a good couple hours. And that's why I like to repeat smelling at least, 3 to 4 times throughout the daytime, like on a regular basis, at least every 4 hours. But if I'm working on something specific with my mom, we did it every 2 hours. We were smelling something with her. Because what I find is if you smell something and you get good results, if you stop it for too long, now you have a longer way to get back up into balance. But if we can maintain this level of balance through scent and keeping emotions balanced, then you're going to get longer results and you're never going to have that huge dip. Because when you have a huge dip, it's going to take you longer to get back up to that balance.
Okay, thank you. I don't see any other questions at this time. But just to give people a little bit of time, I just want to let everybody know to also join us on September 16th, where Linda Lockett Brown is going to discuss using technology to control blood sugar. Linda's also a previous presenter, and you can find her talks on easy.com under the EduTalk library. And if we don't have any more questions, then I'd like to thank you all for being with us. It's been my pleasure to host you and have a wonderful evening. Thank you, Jennifer. Thank
Thank you
you.
very much. Have a great day.
You too. Thank you.